Hello, this is Dr. Stanley Lang. Welcome to this broadcast, and the topic is, does low glycemic eating control diabetes for the long run or for the long term? And the reason that I wanted to comment on this was because of interactions with two different patients that I had today. And I might title this video A Tale of Two Patients, because it really highlights the truth of low glycemic eating as a strategy that does work for the long run. So the first patient was a gentleman that I've been following for more than 30 years, became diabetic after that period of time. And he's been on my low glycemic eating plan for about 20 years, and he's completely controlled his diabetes during that entire time. He's not been on any medication, has not needed to be on any medication. His blood sugars have always been good, and his most recent A1C, now at age 84, is 5.8, which is pretty good. And he's still very physically active. He's following the dietary strategy very carefully. And the point is that he's been able to follow this plan for 20 years, and it has worked for him. He's not had decline. Now, the second patient is somebody that I visited today in the nursing home, and there's sort of a giveaway. The fact that she hasn't followed the plan is typical of what happens to people that don't follow this kind of a plan. As they get older, they decline. And so she's lost so much function now. She has just recently ended up in the nursing home. And it's possible that she might get out after some rehabilitation, but her activity is very limited. She has not been successful in weight loss, so her increased weight has worn out her joints. She's got a lot of pain when she moves around. This is typical of what happens as people age, especially when they're overweight, which is over 60% of our population, approaching 70% of our population. And she was offered multiple times the same dietary strategy. Now, when she would follow it for the short run, her blood sugars would immediately come down to normal. But when she doesn't follow it, which is most of the time, her blood sugars are elevated, requiring 2 or 3 medications to try to control them. Now, the first patient is somebody who has experienced what I consider essentially reversing diabetes, which when you work at the process long enough and hard enough with the goal of reversing, then it stabilizes. It stops getting worse. But the natural course of diabetes for most people is that it gradually gets worse. Insulin resistance, the underlying biochemical, major underlying biochemical issue going on, gradually worsens as you pile on one medicine after another if you're not eating in a low glycemic fashion. And unfortunately, most of the dietary recommendations allow too many high glycemic foods to make it even possible to control, let alone reverse diabetes. In fact, when I went and visited this patient in the nursing home today, she had a piece of cake on her plate, and she was eating a diabetic diet. And I've seen this in our hospitalized patients also. This kind of bending of the principle always results in a situation where the person will need medication to control it, and unfortunately, they're going to need more medication as time goes by. Now, my other point that I want to make is that when you learn the low glycemic eating plan, it is fulfilling. It fills you, and it is fulfilling. It tastes good. You don't feel deprived. There are ways to have desserts and low glycemic breads, although you can't go to the store and buy them. You got to make them yourself. But if you're willing to do that, you can have your cake and eat it, so to speak. But it's just not the cake that you're used to eating. It's just a low glycemic version of the cakes, which these are the sorts of things that you can learn easily if you're committed. So the point is, this works for the long run. And when you do it correctly, it stabilizes the chemistry and stops it from going south, from getting worse, which is what happens to patients when they follow the usual plan, because there's too many high glycemic carbs allowed in the usual eating plan for diabetics. So I share these things to encourage you that you can have long-term success. We're not talking about 6 months or a year's worth of success. I have patients that have been just like this gentleman for more than 20 years following this eating strategy, and it's been successful. Now, you can have access to that same eating strategy by clicking on the link below this video. The link is the name of the ebook is called Why Am I Still Fat? But it's the identical program for diabetes reversal that I teach people. My weight loss program and my diabetes reversal program, they're the same program. So if you want to learn more about how to do this, I encourage you to click on the link, get the ebook. I wish you well. Success in your good health. God bless. Have a good day.